Hey, folks, today we're going to talk about a couple of papers touching on tinnitus. Yes, ringing. What did you say? We're going to talk about tinnitus, as well as a paper that just came out on practice guidelines for persistent headaches associated with neck pain. We're going to have some fun here, so make sure you stick around. First, though, here is that. Better than a back rub bumper music. Okay, we made it back. Welcome to the podcast today. I'm Dr. Jeff Williams. I'm your host of the Chiropractic Forward podcast. Glad to have you here. You have drifted into episode number 65. And you know what? I don't mean drifted like a feather or a piece of wood in the ocean. Nothing weak like that. No, I'm talking about dangerous, careless, speedy drifting in the car around a curve, man. That's what I'm talking about. And you know, I'm talking like I've drifted in my car before, and I have to say I haven't. I haven't at all. Well, at least not intentionally, but we won't talk about that one time down in Alpine, Texas, okay? Shh, don't worry about it. Hey, I used to be in a touring band, okay? What do you want from me? I used to be on the ornery side. That's all I'm saying. And you know what? Maybe I'm still a little on the ornery side, but age has settled me quite a bit. As far as you know, anyways. But I feel like age has settled me quite a bit, which is a good thing. I look at kids these days. My son, he's a teenager, and really, for the most part, he's just so good. He's a good kid. No drugs, no drinking, no smoking. He's as loving as he can possibly be. I think back to when I was his age, man, I got to tell you, I was legitimately a menace to society. I mean, and I really was. It's a wonder I'm alive. But as with most of us from my generation, we made it, didn't we? In spite of all the lead paint, the lack of bicycle helmets, in spite of all that stuff, yet we persist. I want to take just a few seconds to thank Dr. David Graeber. He gave the Chiropractic Forward podcast a shout-out to a room of about 1,000 chiropractors during his talk at the Parker Seminar in Vegas a week or so ago. And while that doesn't seem like that big of a deal, honestly, I'm just going to say that when you feel like a lot of times you're on your own and everything depends solely on you and your actions, or, as it may be, your inactions, well, it's a blessing to have others help share the word. When you guys share or help us get the message out in any little way, it's like I breathe a little easier, if that makes any sense. It's like I'm part of a team rather than out here on an island shouting through a megaphone and hoping somebody on a ship that's passing by happens to hear me. So it's nice to know that you're appreciated, and it's nice to know that you are providing value, and it's nice to know that, you know, maybe there's some other people on the team. Anyway, I know I thanked you in our private Facebook group, but wanted to do so here as well. Very much appreciated, mi amigo. So let's get on with it here. We're here to advocate for you, for chiropractic. We're here to give you some awesome information, trying to make your life easier from day to day. And we're going to keep you from wasting time in your week and give you confidence in your recommendations and treatments. I feel confident in guaranteeing you that if you listen and you stick with it here at the podcast, we can really get all of that done for you. So stick around. Don't just listen to one. Go listen to all of them. You're going to be better for it. I do believe that. Now, part of saving you time and effort is having the right patient education tools in your office, tools that educate based on solid researched information. And we offer you that. We've done it for you. We're taking pre-orders right now for our brand new evidence-based office brochures, which are available at chiropracticforward.com. Just click the store link at the top right of the homepage, and you'll be off and running. Go check it all out. Shoot me an email at dr.williams@chiropracticforward.com if something's out of sorts or if you got a question. Now, let's talk a little bit about the DACO program. Just like every week, I'm going through it, so why wouldn't I talk about it? What does DACO mean? Well, that means Diplomat of the Academy of Chiropractic Orthopedists. Why do the DACO? Why? Well, because if you want to integrate, you need to certificate. That's my new saying. What's the Johnny Cocker in the O.J. Simpson? If it doesn't fit, you must have quit. Yeah, no, this is my version, and it is, if you want to integrate, then you need to certificate. So, or more accurately, you need to specialize and get accredited. That's what the Diplomat is all about. Bells, whistles, letters behind your name. Yeah, sure, there's all that stuff. But more importantly, you're going to be leaps and bounds beyond where you were prior to starting it. And that's really what it's about. Recent classes for me have been tinnitus, which we'll talk about in a moment. Then I had carpal tunnel syndrome as part of a double crush syndrome. And then managing hip osteoarthritis. Just really fascinating stuff. I promise you it's more fascinating than it might sound. I promise. I saw a chiropractic student upset on Facebook the other day. And he was upset because of some video that popped up on social media. It was an anti-vaccination speech, and honestly, it was pretty vile and hateful. And I think she was trying to go for the shock value, so it was a little extra vile and hateful. But it was in the stance against vaccines, obviously. But the cool factor on it was negative, like 23. It didn't have a zero cool factor. It was negative 23, completely uncool. So, look, you have whatever opinion you want on vaccines. I don't care. I just don't care. We're never going to get into that discussion here. That's not even why I mentioned this. The student, though, clearly did not agree with this speech, and the speech was from CalJam, and he was wondering what kind of profession he's spending all of this money to be a part of. He's going into all this debt, and then you got chiropractors acting this way at a huge event. He was basically questioning what kind of future he's going to have when you have a profession that is getting continuing education hours for speeches like that. And I could confidently tell him, and I can confidently tell you, by the way, that there has never been a better time to be a chiropractor, and I absolutely stand behind that, at least not in the last 35 to 40 years anyways. Now, we've all heard, well, I think you've all heard about the Mercedes 80s, right? This is a very, very popular time for chiropractors, older chiropractors, to remember back to, and they sound real nice. But at this point, they're a pipe dream. Right now, there has never been the research backing up what we do. Never. And we have it overflowing in abundance even, not only for our effectiveness, but we have research on how we're more effective than PTs. We're more effective than MDs and DOs for certain things. We have research on how patients are more satisfied with our outcomes than any other practitioner. We have research on how we do all of that while costing less. Never before have we had a national epidemic. This little thing that we call the opioid epidemic, you hear me harping about all the time, that little thing that's driving every healthcare practitioner to look for non-pharma means of treating their patients. You know who that is? That's me, and that's you. That's who they're sending people to because of this opioid epidemic. Never had that before. And never before have we had the capability or the opportunities that we have now to integrate with our medical colleagues and become more and more a part of a team of healthcare practitioners, all with one goal, which is obviously making our patients better. We're moving more and more to the center rather than staying out on the fringes of healthcare, kind of like the redheaded stepchild. And no offense to redheads or stepchildren, but, that's the way it is. Anyway, Diplomat programs are more than letters behind a name. They're about progressing you and progressing your profession, building knowledge and building respect. And I promise you, I get nothing for talking about the DACO program, nothing at all. I just think that certification and professional standardization are really important things. They're not just concepts, they're things that we really need to be working towards. So email me at dr.williams@chiropractic4.com. If you have some questions about getting started, I'd love to point you in the right direction. Now, oh man, if y'all have been following this for a little while, y'all know that my front desk woes have been epic, and the hunt for the front desk rock star continues. I mean, can you believe it? I want to share with you the fact that Indeed.com and Facebook work ads are great at netting you about 1.3 million resumes, but not good at getting you well-qualified candidates from my experience. Every damn time I post a job listing, I'll get around 150 recipients or resumes, whatever the hell you want to call them. Only a limited few are worth anything. Most aren't even qualified for the job. They're just like going down, checking boxes, like click, click, and I'll go for that job and this job and this job and doo-ba-doo-ba-doo, pop, pow, pow, and you know, so now we're sitting here going through a bunch of garbage. It didn't even pertain to our job that we listed. For instance, I got a resume yesterday from a dude that can run a forklift.
Unbelievable.
Now, you know what? I like forklift drivers just fine, but that's not going to get it done at the front desk of a healthcare facility, right? It's an insane waste of time going through all of these resumes. But what the hell else are you going to do? You have to have an employee. And I'm not going to my friends and ask them if they know of anyone, because you know what's going to happen? They're going to be hitting me up for a job themselves. And, you know, I don't do that, because what happens here is if that doesn't work out, not only have you lost an employee, but you've also lost a friend. So no thanks. All right, on to item number 1. I have had an increase in tinnitus in my left ear after a plane ride I took back from Austin, Texas a couple of weeks ago. Bad enough that I went to the specialist for it. Turns out, she said I have, in some frequencies, moderate loss. And I said, I'm sorry, what'd you say?
You cracked me up.
Well, I've been a touring musician before, so, you know, what's new? I could have told you that, but it's been bad, like really bad, in just the past couple of weeks. So something changed in that window of time. It's not gradual hearing loss from being a musician. So I started taking some DACO classes and noticed one of the classes was on tinnitus. So I jumped straight to that drill for obvious reasons. I don't want to go into details of the class necessarily because we'd be here for a while, but I do want to talk about some of the research cited for the class. And we'll start with this one called, Does Multimodal Cervical Physical Therapy Improve Tinnitus in Patients with Cervicalgenic Somatic Tinnitus? Authored by S. Michels and P. van de Heining and a bunch of other very difficult names to pronounce. But it was published in Manual Therapy in 2016. Here's why they did it. Tinnitus can be related to many different etiologies, things like hearing loss or noise trauma, but it can also be related to somatosensory system of the cervical spine called cervicalgenic somatic tinnitus. Knowing that case studies have suggested a positive effect of cervical spinal treatment on tinnitus, this study wanted to dive a little bit deeper onto that, and here's how they did it. It was a randomized controlled trial of subjects having a combination of tinnitus and neck pain. Kind of like a combo meal, right? Instead of a burger and fries, it was neck ache and ear ringing. So make that 2, please. Thank you. Each subject received cervical physical therapy for 6 weeks, which equaled 12 sessions. And here's what they found. Cervical physical therapy can have a positive effect on subjective tinnitus complaints in patients with a combination of tinnitus and neck complaints. So pretty cool stuff there. Item number 2, let's double down with this one from Oostendorp et al. I love that name, Oostendorp. I have 100% confidence I'm pronouncing that, but I don't care. This one's called Cervicalgenic Somatosensory Tinnitus, an indication for manual therapy with a question mark, and part 1 theoretical concept. It was published Manual Therapy in 2016 as well. So here was the big idea. Tinnitus can be evoked or modulated by input from the somatosensory and somatomotor systems. This means that the loudness or intensity of tinnitus can be changed by sensory or motor stimuli such as muscle contractions, mechanical pressure on myofascial trigger points, transcutaneous electrical stimulation, or joint movements. So interesting, yeah? And I think so. And when they went on to say, the neural connections and integration of the auditory and somatosensory systems of the upper cervical region and head have been confirmed by many studies. These connections can give rise to a form of tinnitus known as somatosensory tinnitus. Broadening the current understanding of somatosensory tinnitus would represent a first step towards providing therapeutic approaches relevant to manual therapists. Treatment modalities involving the somatosensory systems, and particularly manual therapy, should now be reassessed in subgroup of patients with cervicalgenic somatosensory tinnitus. End quote. And that's just what they're doing. Fascinating stuff, considering that you've always heard, well, you're just going to have to live with that ringing in your ears. It's just, that's what happens when you get older or listen to loud music or whatever, power tools, all that good stuff. Basically, what they're finding, what they're saying is that if you can change the intensity, the quality, or frequency of the ringing by, say, moving your jaw or stressing the cervical spine in different directions, well, then there's more of a solid chance that you can change the tinnitus completely through cervical manipulation or manual therapy. And if I remember correctly, the guesstimate was around 65% of the cases potentially can be affected by chiropractors in the positive. So, hell yeah, and pass the potatoes, people.
You've been acting really weird lately.
On to number 3. Item number 3, our last thing today is called Non-Pharmacological Management of Persistent Headaches Associated with Neck Pain, a clinical practice guideline from the Ontario Protocol for Traffic Injury Management. Collaboration is written by Pierre Cote, Hanan Yu, Heather Shearer et al., published in the European Journal of Pain, February 2019. You know what that means? It means it's hot off the presses, and I know you like it served hot like that. Cold, lukewarm education, not good enough. Nope, not as good as piping hot brain nuggets, which we got right here. So watch out. Here's why they did it. They did it to develop an evidence-based guideline for the non-pharmacological management of persistent headaches associated with neck pain, i.e., examples, tension type or cervicalgenic. Tension type, 40% of the headaches you see in your practice are tension type. So listen up, folks. Here's how they did it. This guideline is based on systematic reviews of high-quality studies. A multidisciplinary expert panel considered the evidence of clinical benefits, cost-effectiveness, societal, ethical values, and patient experiences when formulating these recommendations. Now, here's what they found. Stick with me. There's a list of 9 of them here. When managing patients with headaches associated with neck pain, clinicians should, here's what you should do. Number 1, rule out major structural or other pathologies or migraine as the cause of headaches. So you kind of need to be up on your headaches. Hint, psst, hey, just between me and you, the DACO helps you on that deal. Number 2, classify headaches associated with neck pain as tension-type headache or cervicalgenic headache once other sources of headache pathology has been ruled out. Oh, DACO. DACO. Number 3, provide care in partnership with the patient and involve the patient in care planning and decision-making. Number 4, let's back up. That number 3, that sounds a little bit like a patient-centered practice, right? Just keeping you there, keeping you on board. Number 4, provide care in addition to structured patient education. Number 5, consider low-load endurance, craniocervical, and cervicoscapular exercises for tension-type headaches, episodic or chronic, or cervicalgenic headaches greater than 3 months duration. Number 6, consider general exercise, multimodal care, like spinal mobilization, craniocervical exercise, and postural correction. And you may consider clinical massage for chronic tension-type headaches. Number 7, do not offer manipulation of the cervical spine as the sole form of treatment for episodic or chronic tension-type headaches. Some of you have a problem with that. Sometimes you need some help. The adjustment doesn't take care of everything, folks. Number 8, consider manual therapy, manipulation with or without mobilization to the cervical or thoracic spine for cervicalgenic headaches greater than 3 months duration. However, there is no added benefit in combining spinal manipulation, spinal mobilization, and exercises. And then number 9, reassess the patient at every visit to assess outcomes and determine whether a referral is indicated. Man, for evidence-informed guys, that all sounds pretty straightforward, and it all makes a lot of sense. And you got to say, this comes out of Ontario, and you got to recognize the Canadians. They just constantly put out high-quality research. They are consistently focused on standardizing their profession with guidelines that all make sense. And I'm just telling you, the Canadians, they're on their game. And I love what they're doing. I love following it. So all of this is just a part of making us all better day to day. If you're paying attention to this stuff, you have a leg up. That's just the way it is, no doubt. See, here's the problem with being patient-centered instead of doctor-centered. We have to be okay with watching the high-volume practices running patients through like cattle. You know, we have to be okay watching them make millions while we have an average case treatment of only maybe 7 to 10 visits. So what? Big deal. I always say that I could have a bigger house and I could take more vacations to better places. But you know what? I sleep very, very well at night. And, you know, being a Christian, as I've mentioned before, I'm at peace knowing I'm square with my Maker, and I treat people the way they should be treated. Religious or not, though, patient-centered doctors can always take comfort in the fact that they're doing what is in the best interest of their patients. It's a lovely thing, right? Honesty, ethics, love, kumbaya, and all of that tomfoolery. They're just little bricks that are the building blocks of an excellent life and an excellent career. On top of that, my message remains the same as it does every single week. I want you to know with absolute certainty that when chiropractic is at its best, you can't beat the risk versus reward ratio because spinal pain is primarily a movement-related pain and typically responds better to movement-related treatment rather than chemicals like pills and shots. When compared to the traditional medical model, research and clinical experience show us that many patients get good to excellent results through chiropractic for headaches, neck pain, back pain, joint pain, and that's just naming a few things. Chiropractic care is safe and cost-effective. It can decrease instances of surgery and disability. Chiropractors normally do this through conservative, non-surgical means with minimal time requirements or hassle on the part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, chiropractors usually can keep it that way while raising the general overall level of health of the patient. And here's the key point if you don't remember anything else. Patients should have the guarantee of having the best treatment offering the least harm. And that's chiropractic, folks. Send us an email at dr.williams@chiropractic4.com. Let us know what you think of the show. We want to hear from you. Feedback and constructive criticism, it's a blessing. So are subscribes. Excellent reviews on iTunes. We love all of that stuff. You know how it works by now. So help us out if you don't mind. We'd love to be at the top of the podcast in this industry. And your help is how we get the message out. Cannot wait to connect with you again next week. From the Chiropractic Forward Podcast Flight Deck, this is Dr. Jeff Williams saying upward, onward, and forward. Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.